Hi, my name is Tom Evans. I'm president of the Iowa Healthcare Collaborative, and I'm here today to talk to you about the Transforming Clinical Practice Initiative and specifically about the Compass PTN. What is this thing? Well, first of all, what's the Iowa Healthcare Collaborative? The Iowa Healthcare Collaborative is a community initiative that was first convened in 2003, incorporated in 2005, but we have about 11 or 12 years of history of trying to take many aspects of the community, bring them together to create a provider-convened community coalition to improve care. We have a lot of experience. We work in performance improvement. We equip hospitals and physicians and other clinicians in just improving performance improvement, or improving performance, but also we are dedicated to using data to affect change. So we do some things on performance improvement reporting, but also on community reporting with regard to healthcare data. Our cornerstones of the collaborative are to align and equip providers for continuous improvement. We promote responsible public reporting, but more importantly, we use data to drive the changes we're trying to implement. And finally, it's all about raising the standard of care. And as we enter this new world of value-based reimbursement, raising the standard of care is the key task. The context for the TCPI practices, the context for doing this is that it's interesting. We're in the midst of national health care reform, and with the Affordable Care Act came renewed efforts to try to improve the operations of the healthcare system. It's important that this isn't just an insurance company venue. This is about the provider community coming together to focus on better care and smarter spending and healthier people as we go forward. As a country, we can't continue to just have a vertical cost curve. Frankly, the country can't afford it. So we need to take the abundant funding we have currently and try to figure out how do we convene ourselves differently to have a more effective care system. This also is based, we're provider-based, but it's also based on the premise that physicians, clinicians, we got into this because we wanted to do good care. So this is about we want to improve care, and but we need to be able to thrive in a new payment system that's basically pay for value. We recognize that there will be increasing accountability as we go forward. It's not just about generating volume, but it's about generating volume that has high value as we go forward. And currently, in the country, there's a move toward value-based reimbursement methodologies. About 16% of the country is currently in some kind of a mechanism like that. But it's very interesting that CMS has a strong commitment to increase the percentages dramatically over the next couple years. The goal of the country, or the goal of CMS, is that 50% of hospitals or of payments to providers will be tied to some kind of an advanced payment methodology by 2018. So the ball is clearly moving down the field. And then finally, the idea is with CMS support that successful practices can work with peers and get. The idea is that we'll be able to kind of bring groups together to facilitate this transformation together. I think it's important, I've used this analogy a couple of times, but in our value-based world, moving from volume to value, it's like a completely different sport. What we've done, and if you think about the volume-based world, it's been like a big fishing tournament. Everybody gets in their own boat. They all leave at 7 in the morning, they go out and they fish all day, and then at 3 o'clock they come in and they compare all of their fish. They see who caught the most fish and how big they were, and they just determine who wins the tournament. Part of our problem with this volume-based situation is that we have a doctor boat, and we have a hospital boat, and we have a long-term care boat, and the fact is we're a pharmacy boat, but we're overfishing the lake. We have all of these boats competing on volume, and there's not a lot of coordination there, and it's basically there's a lot of waste and duplication in the system. There is a better way. So with the value-based methodology, what they're doing is the world is moving to a methodology not like so much fishing, but more like football. In football, you have 11 people on the field at a time. They all are lined up and they have specific tasks. Everyone has a specific job that they have to do. They have to do their jobs in a coordinated fashion. Not only that, the timing is important. They all start at the same time, they all stop at the same time, and they're rewarded in the same way. They all move down the field together, they all get penalized together. And frankly, the team doesn't win unless they score, and you only score together. So when you look at what is going on with healthcare, there's this integration moving from fishing to football. There's an integration in healthcare in the same way that we're going to be tied. We're going to have our hospitals and our physicians tied together, but we're going to have our hospitals and physicians and long-term care and pharmacy tied together. But it's more than that. We're going to have our hospitals and physicians and long-term care and pharmacy and our public health and our area agencies on aging. All of that is going to be kind of the community piece as well as the provider piece will be tied together, overall being responsible for the health of the population as we go forward. It's a new day and it's a fun day. But back to clinical practice, when you look at how does this impact us when we deliver care? Well, in the traditional model, patients will present with a chief complaint, and then that drives whether they're going to come to the office or not. In the transformed practice, when a patient is into the office, we don't just look at their chief complaint, but we may think more broadly and think of many other things we could see then, deal with them when they come in. The care in the traditional model, care is determined by today's problem and only the time I have available to provide to the patient. It isn't really patient-centric. Well, in the new world, the care will be determined by some kind of a proactive, patient-centered plan. What's important to the patient, what does the patient need, and what will be best for the patient's well-being and overall health over time. With regard to quality, the care may vary in the current model by scheduled time or the memory of the physician, what I've got in my brain. But in the transformed model, it's much more standardized. We have standardized metrics. We practice according to evidence-based guidelines, and we do what the latest stuff is. But it's pretty much standardized. There's an offense that we're all going to run together. In the current system, patients are responsible for all that care coordination stuff. It's up to the patient to go from the primary care to the specialist or to physical therapy, and it's their job to set up those appointments and handle that stuff. In the future system or in the new system, you'll have a prepared team of professionals that are actually coordinating the team's care. There will be better discussion between the hospital and the specialist or the physician, the primary care and the physician or the physical therapist. It will be everyone working together to have in a coordinated fashion to run that play for the patient. In the current world, how do we know we're good? Well, frankly, today we know we're good because we were well trained. Where did we go to medical school? Am I board certified? What CME am I taking? But it's basically, I know based on what I do and what my certificate says. Well, in the future, it's not going to work quite that way. In the transformed practices where we're moving toward, clinicians are going to know that they're delivering high quality care because they're going to have metrics that they can actually track. Not only their own practice, but how they compare with others, maybe locally, maybe across the state, maybe within a system, but the fact is we'll be compared, we'll know where we are in the bigger global context. And finally, with regard to care coordination, it's really currently it's kind of up to the patient to tell us what's happened to them. Was this guy nice to you? Was this guy not nice to you? Was this effective care? Are you getting better? And in the future, in the new system, the transformed system, we're going to be focusing on centralized data availability so we can track the tests and the consults and the follow-up after the emergency room in the hospital. All of that will be available to us, so we'll have better tools to be able to coordinate care. The Transforming Clinical Practice Initiative, the idea is to take practices who are deeply embedded in the volume-based methodology and equip them to take all the good stuff you do currently, but to add performance improvement techniques so that you can not only do better, but it isn't like, that's not a destination, it's a continued process. The idea is every time you deliver the care, can we make it better and better and better, continuing to aspire to new levels. This aligns closely with the Affordable Care Act, and remember what's going on at the national level. There's broad payment redesign in process currently. This will help us develop those community-based resources so that not just me seeing my patients and then hoping they do okay in the community, but it helps us begin to build those relationships with the pharmacists or long-term care and do much better coordination of care. It's going to be moving, the idea of this practice is we'll take your current processes, and you may not even know what they are, you're just doing what you do, but we'll begin to take certain processes, map them out so we know what our current process is, and then move through 5 phases of improvement so that hopefully from the beginning of mapping, we'll get to a point where you're going to be able to thrive in this value-based world. The 5 phases described by CMS are depicted in this slide. Once we identify what your processes are, we'll set some new aims. Okay, wonder if we can lower our hemoglobin A1Cs in the population at this practice. I wonder if we can lower this infection rate. I wonder if we can do whatever. But set some aims and then put some process changes in place so that we can see if we can improve that. Run those cycles for about 3 or 4 months, and then we'll look at the data and see if we're making any improvements. If they are, we'll hardwire those changes and we'll make some more changes. So we implement this cycle of changing, what's called Plan, Do, Study, Act. Look at the cycle, make some changes, see what's working, and keep doing it, and have this continuous improvement. Obviously, we're going to be using data to drive that care. We can't go on this value journey if we don't know where we're starting from. We need to have the data on what we're currently doing, and then we won't know if we're making any progress down the road if we can't count the mile markers. So we want to look, what does our data look like now, and what is our goal, and then how are we doing on that process. We'll try to get some progress as we move forward. That will take it to level 3. We hope that you will be able to get to a point, we strongly suspect you will be able to get to a point where you're hitting benchmark status. And once you're into that area, we can begin to talk about how do we change reimbursement so that, and you'll be equipped to talk with your payers about how do you change reimbursement to create sustainability for this. If nothing else, you'll be able to demonstrate that your new scores through the MIPS program will be competitive, and that's our main goal, so we can create sustainability. This TCPI is a sustainable practice redesign. What we're trying to do here, this is a collaborative, peer-based learning initiative. When your practice signs up for TCPI, you're committing to be a member of a learning community. And these learning communities, there will be other practices here doing the same thing you are, and what you can do is begin to ask the questions, gee, what worked for you? How did you get over that? It's amazing to us when we bring groups together like this. They can be staunch competitors, but when they go to work on the same programs and the same problems, it's amazing how your competitor can actually help you solve your problems. So this will be working in these learning communities, but there will also be resources to come on site to help you. This will be an opportunity to engage clinicians and physicians, but also their patients and their families and their communities to build those stronger local partnerships and improve health and healthcare on the local level. And I think it's really important to recognize that this will be bi-directional in your learning. This won't just be us telling you what to do, but we will be receiving information from you on how you overcome barriers, and there will probably be situations where we may be highlighting your success before the whole network so that everyone can learn from what you're doing. The other piece is that with CMS, this is a CMS project, and CMS is convening this, and CMS will be bringing resources down to us or promoting us sharing it with each other. It's very important for you to know that the TCPI practices will also be generating messages that will go up into CMS. They're building reimbursement policy today. This is their little science project. So for you to be involved in this project actually brings your voice, it amplifies your voice and brings it to Washington, and hopefully with most of our partners are in a rural environment, hopefully we'll be able to actually influence the policy in Washington, D.C. These are the goals of the project, overall goals of the TCPI program, to engage 140,000 clinicians to improve health outcomes. Notice what that doesn't say. It does not say this is about just reducing reimbursement. It doesn't say this is about changing payment methodologies. This project is about engaging 140,000 clinicians to do things differently and improve health outcomes. We do have a goal. We want to reduce hospitalizations. So TCPI is working in the clinical practice arena. One of our goals will be to do a better job of managing on an outpatient basis so the inpatient world is impacted. We hope to generate between $1 and $4 billion in savings to the federal government through our clinical practice initiatives. We hope that we'll be able to create some improved value through reducing unnecessary testing and procedures. And I think it's important that, I mentioned this is a big learning community, but we want to capture the lessons that we learn and then make sure that they can be spread more easily across the country to facilitate this transformation of healthcare in our country. This is a kind of a complicated slide, but the Pentagon on your right here is referring to, if you think of it as your community. There's community resources, your ambulatory and post-acute care, public health services, hospital and healthcare services. That's all great. Those are all components, and we want to interact with them and work synergistically with them. But this project is working on the circle that's blue, the primary and the specialty care clinicians and practices. And the blue box to the left is the Practice Transformation Network. So we will be working directly with the practices assigned here. We have a recruiting target of over 7,000 clinicians in this project. It's interesting in that stack on the left, the Practice Transformation Network is what we are, but we'll be working closely with the yellow box, which is National Support and Alignment Networks. These are organizations that have a larger constituency and can really help support us, but also align our work. So case in point, I'm a family physician, but the American Board of Family Medicine, working with the American Academy of Family Medicine, is a support and alignment network. They are also working to do this work. The American College of Physicians, the American College of Radiology, there are 10 support and alignment networks that will be large context-setting organizations that will be working with us to engage clinicians across the country. The red box is just a statement saying that we will be aligning federal and state programs as well with this work to transform clinical practice. This slide depicts where we are. The Compass PTN, while I am with the Iowa Healthcare Collaborative, we are the convening organization for a 6-state initiative. It looks like, well, currently we have 6 other states that are participating. There may be others as we go forward. But as you can see, we have a strong Midwestern relationship and then a strong relationship with the state of Georgia as well. This slide is just another depiction of that, but we have partners in each one of these states that serve as kind of a lead organization. And these organizations with this project will not only bring resources to you locally, but will be convening learning communities locally at least once a year. So these will be the convening organizations for those learning communities. Why would you do this? Why would you want to participate? And we believe this slide, we think there's a lot of value to clinicians participating. This slide is intended to kind of explain that. We think that, number one, this is good medicine. This optimizes your health outcomes for your patients. I know you all do good medicine already. I know you're all good doctors and all good clinicians, but the fact of the matter is we aren't trained with the methodology to continuously improve how we do what we do. We just keep taking CME. That's not fast enough. So this project will be bringing meaningful, pithy changes into how we process, map out how we do our diabetes care or how we do some different pieces, and we'll bring best practices in to make that better and make it move forward. This is good medicine. Number two, it's going to promote care coordination, the coordination with your primary care, your specialty, your hospital, but also with resources within the community, area agency on aging, public health, etc. There's an opportunity with this under number 3 to learn from high performers. In the Compass PTN, we have already some very high performers and we have some folks that are just getting started. It's very important that we capture the lessons that are out there and spread them rapidly so that we can raise the standard of care more quickly. We believe it or not, this sounds like a lot of extra work, but we really believe that this will result in more time spent caring for patients. As you improve your systems, as you improve how that patient experiences, how they come into the office, it may not be you doing everything. It may be, you may have teams now as you identify who carries the ball on this play. It may not always be you. We think for the clinician, this will end up with more time for direct patient care and relationship, and that's important. Number 5, alignment with new and emerging federal policies. There has never been a time in my practice life, and that's since 1986, there's never been a time where there's been this much change in such a period of time. And the federal policies, we have, for instance, the MACRA has been enacted into law, but administrative rules are still being written on how that will be carried out. this is a chance for us to impact the way those rules are written. So the more engaged you are, the better chance we are to actually shape our future going forward. That's with the new federal policies. There's also, this learning community. Remember, I think I've mentioned that there are 850,000 clinicians in the country, and this will work with 140,000 of them. This is almost like a small pilot group, and the opportunity to be a part of the national leadership. You will have an amplified voice in dealing with the change that our country and our reimbursement system is encountering. I guess number 7, it's important to know that there's no cost, there's no risk. This is free. It's interesting. We are sitting here trying to give away resources. We're asking you, if you are a MIPS eligible provider, sign up and let's see if we can't work together to try to improve your scores. And then finally, this prepares you to be successful not only with MIPS but also with the advanced payment methodologies. MIPS, if you're in a Medicare Shared Savings Program, you're not eligible for this program, but there are many folks that have signed up for advanced payment methodologies and don't really know how to do this stuff. So what we're going to be teaching will be good for you whether you are in MIPS or whether you graduate and go into an advanced payment methodology over time. Both sets, both destinations, this is good for both. Expectations. What do we expect from you? If you decide to participate, well, your practice will need to sign a charter that just says, yep, we get it, we're going to be there, and there's a business agreement that comes with that, but it's basically there's a formal recognition that we're going to be participating together. The reason for that is we've got to have the information gathered, demographic information of participants as we go forward. The other commitment we'll ask you to make is to progress, and that's to go through those 5 phases of improvement. Identify that you're going to process map out what we're doing, we're going to set some aims, and we're going to begin the journey together of doing performance improvement through serial PDSA cycles in our practices. We ask that you would identify a contact, a key contact at your clinic that we would work with, a PTN point of contact. And the other requirement is that you can't take this journey if you don't know where you're starting. So we're going to have data. It's important to realize that with the MIPS methodology and the new collective scores that are going to be brought together, they're going to be the PQRS methodology, the meaningful use methodologies, that data that you are incented to report to now will be embedded in that. It is the future. So our recommendation is start with what you already have, but you're going to have to send us that data so that we can begin to build run charts and we can help you improve that data going forward. I mentioned earlier we're going to be doing PDSA cycles, and what we're going to operate this with is 4-month PDSA cycles, and so you're going to do that. You're going to have an improvement coach that is going to be coming to your site occasionally to kind of help you make sure you can eliminate barriers, and we're going to ask you to participate in these learning communities. Finally, we want you to participate in educational venues, but more importantly, we want you to share. We want you to talk about what you've learned, what you've seen, what are your barriers, and how did you overcome them. We can help you overcome your barriers, but we also want you to become a champion for transformation in this project. So with this, the last slide is basically just our website, and to tell you we're happy to have you here. I hope this has been helpful today, and we have plenty of resources here at the Compass PTN to help you on this journey. Good luck. We're here to help.